Hello, everybody. My name is Darlene Merkler, and I'm with Inland Caregiver Resource Center. I'm here on Facebook Live every Tuesday and Thursday at noon with 15-minute tips for family caregivers. This week, we're going to be talking about the dementias. I gave a presentation not long ago about is it normal aging or dementia? And we talked about the fact that what is the difference between Alzheimer's and dementia? You hear those two terms quite a bit. Dementia, before we get started, I just want to explain what the difference is. Dementia is the umbrella term, and there are many different kinds of dementias. Alzheimer's is the one that we hear about the most because it accounts for 60% of all the dementias. So I want to start off by talking about what is dementia. And when I say dementia, that includes Alzheimer's disease, and we're going to talk specifically about different types of dementias and Alzheimer's disease and what the symptoms are and characteristics for the different types of dementias so that you have a better understanding of that. So dementia refers to a group of symptoms that can be caused by several different brain disorders. In general, dementia is characterized by impaired intellectual functioning that interferes with daily activities or personal relationships. The impairment can include memory loss, language difficulty, decreased perception, and impaired reasoning. So that's a really good definition of what dementia is. So what causes dementia? A lot of people ask me, is it hereditary? What causes it? So it's kind of a combination of things, but all forms of dementia are the end result of either cell degeneration and death or abnormalities impeding communication between brain cells or the neurons between brain cells. So in many of the common types of dementia, abnormal proteins or abnormal amounts of normal occurring proteins are found in the brain tissue on a microscopic level. So it's not really known if the proteins cause the dementia or if the proteins show up as a result of the disease itself. So that part is still unclear by science. While some types of dementias are hereditary, many are a result of a combination of genetics, environment, and lifestyle. We'll talk more about that. First of all, I want to talk about the three areas that symptoms affect. The first one is the cognitive impairment part, and that's the one that we're most familiar with. But it affects memory, language, attention, thinking, orientation, calculation, problem solving abilities. So that's the cognitive impairment part. The next part I want to talk about is the psychiatric and behavioral problems. This is with dementias in general. We will notice changes in personality, changes in social behavior, emotional changes, hallucinations and delusions in some cases, aggression in some cases, depression, and agitation. That's the psychiatric area. The daily living area that is affected is dressing, driving, eating, shopping, medication compliance. And there are probably some more that you as caregivers can think of. The different types of dementias, the one is called cortical dementia, and that's a dementia where the brain damage primarily affects the brain cortex or outer layer of the brain. Cortical dementias tend to cause problems with memory, language, thinking, and social behavior. Subcortical dementia is a dementia that affects the part of the brain below the cortex. Subcortical dementias tend to cause changes in emotions and movement in addition to problems with memory. Progressive dementia means that the dementia gets worse over time, gradually interfering with more and more cognitive abilities. Primary dementia means that the dementia gets worse over time, gradually interfering with more and more cognitive abilities as well. And then secondary dementia, dementia that occurs as a result of a physical disease or injury. So Alzheimer's disease is the term that we hear quite often, and the most common cause of dementia, as I had mentioned before. More than 5 million people are living with just Alzheimer's disease, and 500,000 die each year from it. So that's the one that we hear the most. Alzheimer's is the sixth leading cause of death in the United States and the fifth leading cause of death of seniors 65 and older. So 2/3 of seniors with Alzheimer's disease are women. Up to 5% of those living with Alzheimer's have the early onset form of dementia and are diagnosed in their 40s or 50s. Alzheimer's disease usually causes a decline in thinking ability, memory, movement, and language. Bizarre, withdrawn, or paranoid behavior may also occur with that disease progress. The first person that was diagnosed with Alzheimer's disease was in 1901, and that was Auguste, I'm not sure how you pronounce her first name, but Dieter, Auguste Dieter, and she was a woman in her early 50s. She became the first person diagnosed with Alzheimer's disease, and the disease is named after the doctor who diagnosed her, Alois Alzheimer's. I think some of you might have already known that. So on a microscopic level, Alzheimer's disease shows up in the brain with two characteristic abnormalities: amyloid plaques and neurofibrillary. Those are big words. I'm going to talk too much more about Alzheimer's disease, but I do want to talk about vascular dementia. Vascular dementia may be caused by brain damage such as a stroke or arterial sclerosis. So many times, not many times, but sometimes when a person has a stroke, they can be affected by vascular dementia. There's another type of dementia called Lewy body dementia, and it's the third most common type of dementia. And many of you may not have heard of Lewy bodies dementia, but you may have heard of Parkinson's disease. Lewy bodies is similar to Parkinson's disease in that it affects a person's body movements. The Lewy body dementias are similar to Alzheimer's, including impaired memory, confusion, and poor judgment. It also includes hallucinations and Parkinsonian symptoms, as I mentioned. Another type of dementia is frontotemporal dementia. The front part of our brain is where we house our filtering system. So many of us may walk down the street and see someone in an unusual outfit and think to ourselves, that's weird, or that's really an unusual outfit. But we wouldn't probably say anything to the person. Whereas a person with frontotemporal dementia does not have that filter, and they would just blurt out whatever they were thinking. So the frontal and temporal regions of the brain control behavior, judgment, emotions, speech, and some movement. So damage to these areas accounts for the symptoms that separate frontotemporal dementia from other types of dementia. It's pretty clear to see by a person's behaviors if they have frontotemporal dementia. It usually occurs in younger patients in their 50s and 60s, and it is believed to account for 10 to 15% of all the cases of dementia. Behavioral changes appear early on in the disease with the frontotemporal dementia, differing from the late onset of that in Alzheimer's disease. Another type of dementia is HIV-associated dementia. The main symptoms of that, they use HAD for the abbreviation, which is HIV-associated dementia. It includes impaired memory, just like the Alzheimer's disease, lack of concentration, withdrawal from social activities, and speech difficulties. Medications to treat HIV/AIDS may delay the onset of the dementia symptoms. So that's kind of a good thing. Huntington's disease is a genetic disorder that causes an abnormal protein to form in the brain, and it's called Huntington protein. The symptoms of Huntington's disease is that this leads to brain changes that can cause abnormal movements, a decline in cognitive skills, irritability, depression, and anxiety. Some patients may progress to show psychotic behavior. Huntington's disease begins earlier in life than most types of dementia, typically between the ages of 30 and 50. Life expectancy after the onset of the symptoms is between 10 and 15 years. Okay, so that is all I'm going to talk about today. On Thursday, I will continue our discussion on the dementias and some of the diseases that I'm going to talk about on Thursday that have dementia symptoms is Parkinson's disease, normal pressure hydrocephalus, and quite a few other ones that maybe you might not have heard of before. So I'm going to continue the discussion about the many types of dementia on Thursday. I hope to see you then. I did just recently post on our Facebook page the August schedule for all of our workshops. We have 4 workshops this month. I have one tomorrow, I believe. But I did post that, and it's called Caregiver Decisions Paradigm. It's a pretty good one. So that will be a 1-hour Zoom presentation. The workshops you do need to register for. You could just click into the link that I post when I post the flyer on Facebook. You can just click into the link of the one you would like to register for, and then you're automatically sent the sign-in information for Zoom. So we have 4 of those in August. We have 12 family caregiver support groups in August, one of which I conduct on the 3rd Thursday from 6 to 7:30 p.m. That's our only evening one. Speaking of Parkinson's disease, we do have a Parkinson's disease specific support group. So if you're caring for someone with Parkinson's disease, we have a support group that deals just with that. And I'm very excited because this month in that particular support group, we have a physical therapist from Ballard Rehab that's going to be speaking to us about a specific program that they do at Ballard for physical therapy for people just with Parkinson's disease. So we have the 12 support groups. We have Facebook Live on Mondays and Wednesdays, Tuesdays and Thursdays with me, and then on Wednesdays with Crystal. And I think I heard that this month Patty, my coworker Patty, is going to be taking over the Spanish-speaking Facebook Live presentations on Wednesdays at noon. So I will repost all those flyers for you, but if you have any questions, please comment on our Facebook page, send us a message, or you're welcome to call our office at 909-514-1404. I'm looking forward to seeing you on Thursday and maybe at one of my workshops or support groups. Everybody have a great day. Bye.